Hey guys, welcome to another video for anatomy and physiology. In this video we're going to be highlighting the femur. We've got a lot to cover, so let's go ahead and get started. So we're talking about the femur today, and I purposely am doing the femur right next to the humerus because they're actually kind of similar. They have some similar features. The femur is the largest bone in the body, and it goes from the hip to the knee. Now, notice I'm not saying the largest bone in the leg because the leg technically is considered the knee joint down. So we're talking about the femur that's in the femoral region of the lower limb. So, kind of like the humerus, you have the head, right? This head articulates with the glenoid cavity, or not the glenoid cavity, that's the humerus, with the acetabulum. Okay, that goes into the pelvic region. So you'll notice here, now this is a little different from the humerus in that the femur, the head of the femur is a little bit more well-defined spherical shape, whereas the humerus, not so much. It's kind of like a half circle, but the femur has a very well-defined head and also a very well-defined neck, unlike the humerus, where we kind of had to imagine the neck, that feature on the humerus. But here you have it. I mean, it's like the neck of any other head of any other organism. Most heads do have a neck, I guess, unless you're a crab. But the femur, unlike the humerus, has a very well-defined one. Now, also we have a greater and a lesser trochanter. Now, that word trochanter, think of a horse. So, horse typically can canter, it can gallop, it canters. And that has to do with the legs, right? Now, with the humerus, you have a greater and a lesser tubercle, right? So, the greater trochanter, greater trochanter is a place of attachment for your gluteus medius, and then the lesser trochanter, the psoas major. Okay. Now, in between the greater and the lesser trochanter, you have something called the intertrochantic crest. Now, this is a spot. This is a place. Here, let me highlight it right there. This is a place for articulation for the quadratus femoris. Just recall that that the bones with these somewhat random-looking features are all features that have a very specific purpose, and typically it's for an articulation to another bone or for a muscle. So do keep in mind that as we're looking at these features, that right now we're looking at the femur from the posterior aspect, right? Because if this is the head, that means this is the part that articulates with the hip. That means we're looking at the leg from the posterior side. So this is where most of the stuff happens. Let me just go ahead and turn it around real quick, and let's look at the anterior portion of the femur. Now, as you can see, there's not a lot going on here. Pretty plain for the most part. So as we flip it back, now you can still see the features on the proximal end. You can see the head and the neck and the greater trochanter and a bit of the lesser trochanter there. But let's turn it back. Let's turn it back to the posterior side. Okay, now you'll see this little line here, this feature. This is called the, here, let me get closer. This is the gluteal tuberosity. So this gluteal tuberosity, as you might imagine, is the connection point for your gluteus maximus. And then here, this long line that goes all the way down the posterior side of the leg, of the femur, is called the linea aspera. Let me highlight that. The linea aspera. Now this is a major feature because this is a connection point for 9 muscles. And I'll go ahead and just list them on the screen here so you can see the 9 muscles. I won't really get into listing all of them. When we get into the muscles and talk about the specific muscles, then yeah, we will. But as we're making our way down distally to the leg, we have 2 features here. We have a medial and a lateral, what's called a supracondylar line. Here, let's go up there. Supra meaning above, right? This is the medial. This is the medial, and then this is the lateral supracondylar. Supra meaning it's just above, and here we have our 2 condyles. Okay, the lateral condyle and then the I'm sorry, this is the medial condyle and this is the lateral condyle, which means this prominence here is called the epicondyle, which is on the outermost portion. And then here's the medial epicondyle. Okay? Now let's talk a little bit more about these condyles. So the medial condyle, it bears more weight due to the center of gravity being on the medial knee. So as you can see, it's a little bit bigger than the lateral condyle. So that's my lateral condyle, and then in between here I have a fossa. Okay, this is called that's in between, intercondylar fossa. This intercondylar fossa, pretty important feature here because it articulates, or it's an attachment point for your ACL, your anterior cruciate ligament, your PCL, posterior cruciate ligament, the lateral meniscus, and the medial meniscus. So it's pretty important here. Here, in fact, let me rotate this so you can see that space, that groove, that space in between there. All right. So let's go ahead and flip this around to the anterior side. My lateral epicondyle, this is the attachment point for the LCL, my lateral collateral ligament. And then as I rotate it medially, you can see this is my medial epicondyle. And as I compare the two, you can kind of tell a little bit that it's bigger than the lateral. And that's due to the fact that for the same reason that the medial condyle is larger, because the center of gravity is more on the medial side of the leg. So it is a little bit bigger. So hopefully that's something that you can use to kind of help you remember which is which. Okay, so my medial condyle and my lateral condyle, and then my patellar surface. This is a smooth surface, a space for an articulation for your kneecap, okay, for your patella. Okay, well, as I look at this, I think that's pretty much what I wanted to cover with the femur. Oh, nope, there's one last thing. Of course, how could I forget? This is the shaft. This is the diaphysis of the femur, okay? So this is where a lot of the weight bearing of the body takes place. And so I believe that does now do it for the femur. Thanks for watching, and good luck in your study.
During a total knee replacement, your surgeon will replace your knee joint with a prosthetic knee. Bones in the knee joint include the lower end of the femur or thigh bone, the tibia or shin bone, and the patella or kneecap. Smooth cartilage, called articular cartilage, covers the bony surfaces, cushioning the knee joint and allowing the parts to move easily. The most common cause of knee disability is osteoarthritis, which causes the articular cartilage to wear away, resulting in severe knee pain and stiffness. When pain medication and other treatments are no longer effective, your surgeon will perform a total knee replacement. During the procedure, your surgeon will remove the damaged cartilage and bone and reshape the bony surfaces to fit the prosthesis or artificial joint. Your surgeon will cement up to 3 prosthetic components into place, including a metal femoral shell, a metal and plastic tibial component, and a plastic patellar component. Before closing the incision, your surgeon will bend and rotate your knee to ensure it functions properly. Over 90% of patients experience dramatic pain relief and improved knee function and have a new joint that will last 10 to 20 years.